Well, I grew up in a small town in Minnesota, and I always thought being involved in volunteer services in that community was important to me, and it was important to our entire family, and our parents encouraged that. While I was in PA school, I fell in love with orthopedic surgery, so I took a job at the University of Minnesota in orthopedic surgery, and I worked there for almost 4 years before I decided to go back to medical school. So I just found a love for orthopedics, sports medicine, and caring for those types of patients. I think a lot of times people have the impression that orthopedics is focused on just the musculoskeletal system. And while that's clearly our focus in our day-to-day life, there is a lot of other things that go on in caring for people with joint pain, with ligament ruptures, rotator cuff tears. And there's a lot that goes on in the operative care of those patients. There's a lot that goes on in the rehabilitation end of it. And then when it comes to return to sport, it's really important to make sure that the stuff between their ears is ready to accommodate returning to the field of play. I think a lot of athletes are cut from the same cloth, and I think their goals are all the same, right? They want to be treated effectively, efficiently, and with a lot of compassion and care, with the mindset of getting back to the playing field. And that does not only apply to sporting activities, it also applies to our laborers that are returning to their job who may have had an injury. And it's very important not only to focus on their body part, but also the mental end of having the confidence to return to life. So a lot of the work that I do is done arthroscopically, or scoping joints. And what that means is I describe them as tiny poke holes, usually about the width of your fingernail. We are able to introduce a camera and instruments to do a lot of work in the underlying joint. It has a lot of advantages in that it's minimally invasive. There are small wounds to heal. And in my opinion, based on the training that I have, I think it offers better surgical outcomes. So when we talk about making surgical decisions for patients, I think it's very important to make sure they're educated and that I'm being very transparent with them on giving them their options of care. For certain entities, that can mean non-operative care. It can mean therapy, bracing, various types of injections. But I often will say, we don't treat this x-ray, we're not treating this MRI, we're treating you. Certainly what they do for their job or vocation is important to know. And then I ask everyone, what do you like to do in your spare time? And it's very important to know that, because if they enjoy kayaking, if they enjoy water skiing, if they enjoy snowshoeing, I want to share in those goals of getting them back to the activity that they enjoy. And I don't do these various types of orthopedic surgeries to then wrap patients in bubble wrap and stick them in the corner. I'm doing this so that we can get them back to doing those very things that they enjoy. So orthopedics and sports medicine is absolutely a team-based approach. It takes a village to care for patients. And I depend on my team. I have an athletic trainer and a nurse that work with me. I depend on our physical therapists and our occupational therapists as well. We also have outstanding inpatient care for those that require overnight stays, oftentimes from a joint replacement surgery. Finally, the frontline folks in the emergency room are also important players in this, and the communication that I get from them on urgent, emergent orthopedic issues is tremendous. So I think that's the biggest, myth that people may have about being in Black River Falls is that they can't get specialized care here. And we're here to offer that service from an orthopedic surgery and sports medicine standpoint, and we're very proud to do it.